and welcome to ARAC's GFN Fives video presentation titled Person-Centered Approaches to Sensory, Behavioral, and Consumer Research and Analysis. Now thinking about this concept that individuals, persons make up the whole, how would you describe the global landscape within the nicotine and tobacco industry? Sam, as VP of Global Regulatory Strategy, you analyze how international markets regulate within this space. How do the individuals within these markets fare when it comes to harm reduction opportunities?
So think about smoking cessation as the sum of thousands, well, hopefully millions of individuals making healthier choices. These choices are predicated on lots of different factors: what people know or believe about the products they use and their risks, price mechanisms, regulatory controls, peer and environmental influences. And everyone's unique, so what works for some won't necessarily work for others. Safer alternatives add additional options. That's why we see more smoking cessation as the demand for example, e-cigarettes increases. There's a group that, for whatever reason, was left behind by the traditional tobacco control policies, but with the right alternatives is now able to stop smoking. But again, it's not only about the alternative products and their features, it's also about what the consumer knows about them. And that's largely a response to messaging that they receive, both explicitly from public health agencies, but also implicitly from policymakers. Take the US, for example. On the one hand, we have the FDA approving at least some reduced risk products, concluding after extensive scientific review that their marketing is appropriate for the protection of public health. But federal law prevents the manufacturers from making health relevant claims about them, even when their marketing authorization was predicated on verifiable evidence. At the same time, we've got some states and localities bringing in new regulations, taxing and restricting the sale of safer products, while the status quo for cigarettes remains largely unchanged. And overwhelmingly, the US public health messaging on reduced risk products emphasizes risk. That's an attempt to deter youth experimentation. But no wonder the majority of smokers are confused about safer nicotine. The truism that there are no safe tobacco products masks the salient reality that some are much, much safer than others. Telling people that switching isn't quitting fearmongers people into continuing to smoke. If people don't understand that reduced risk products are indeed safer, that it's combustion and not nicotine that makes cigarettes dangerous, how can we expect more people to choose safer options? And we also need to correct misinformation among other groups too. When healthcare professionals or the friends and family of people who smoke are misinformed about nicotine, we lose opportunities to inspire and facilitate quitting attempts. Even where smoking is declining dramatically, led as it is in Japan and the US by substitutions to safer alternatives, the potential public health benefit is far larger still, because the overwhelming majority of smokers doesn't understand that it's not nicotine that's responsible for smoking-related cancers. So we need to do a better job at aligning health communication and policy to communicate a more consistent message. And the UK is actually a good example of this. There, the NHS advice leads with nicotine vaping is less harmful than smoking. It's also one of the most effective tools for quitting smoking. Now, that advice still communicates that vaping isn't completely harmless. It acknowledges the uncertainty about long-term health effects and reiterates that children and non-smokers shouldn't vape. But crucially, the opportunity is front and center. And that nuanced but clear message is also reinforced with a set of policies that increases the relative appeal of safer products. For example, we haven't seen flavor bans on e-cigarettes in the UK. And safer products like e-cigarettes have also been exempt from the high taxes that are levied against combustibles. So these key regulatory differences communicate to the public the different risk profiles of each product class. The UK has even announced plans to give free e-cigarette starter kits to disadvantaged smokers, and programs like this signal the government's support for THR in the right context, reducing stigma and skepticism. As a result, while there are still misperceptions about nicotine in the UK, these are markedly lower than in other countries. So from a global policy perspective, the lesson learned here is that in addition to having THR products available, we need to align medical advice, public health information, and policy messaging to inform product selections that facilitate smoking cessation.
Please go ahead and scan this QR code to connect with ARAC today. And we look forward to seeing you in June 2025 at GFN.